Catherine, and welcome to The Herd. In this video, I will be discussing many concepts of immunology in relation to cattle. I hope this video gives you insight on how cow-calf operations are managed in order to ensure happy and healthy livestock, as well as allow you to further your understanding of immunology and the importance of vaccinations. Let's go talk about herd immunity, literally. Herd immunity is obtained when a population is collectively immune to an infectious disease. This immunity is acquired through vaccination within the herd. Vaccinations are often given at different stages and are customized to manage each producer's operation. When calves are too young to receive vaccinations, the older cows and bulls' immunity helps to lower the probability of a disease outbreak within the herd. Establishing a closed herd lowers the risk of disease introduction. Therefore, it is important to isolate and vaccinate newly purchased cattle before they are introduced to the herd. Alright, so let's take a closer look at what type of cattle diseases are prevalent and what types of diseases we can prevent through vaccination. So the first type are respiratory diseases. These diseases can be passed by the animals touching mouths. They can be passed through the cough. Or are aerosolized. They can also be passed through contact with common equipment, whether it be water troughs or feed bunks. And some of these diseases can manifest as diarrhea and can be passed that way as well. Secondary bacterial infections also play a role, and if they are not treated with antibiotics, they can die, and especially is fatal for calves who are not vaccinated for these diseases. Therefore, it's important that your older cattle and majority of the herd are vaccinated against these diseases, especially since they are so fatal, and especially fatal for young calves. Sexually transmitted diseases can cause profit loss to the producer as they result in abortions, stillbirths, and weakened calves. And the tricky thing about sexually transmitted diseases is that they are easily transmitted and they are able to go undetected because sometimes a cow or bull may not present the full symptoms, and then later on it comes to find out that this bull has been passing the disease to the cows have been passing it to the bull, and back and forth. So it's a good idea to vaccinate against these diseases to prevent these losses and deaths. So here is a vaccination schedule and just a basic protocol that many cow-calf operations use. Then again, every operation is different. Feedlots do something different than a cow-calf operation would, so on and so forth. Take notice of how cows, replacement heifers, breeding bulls, they are all vaccinated for those sexually transmitted diseases and respiratory diseases. So you don't want anything being passed back and forth among them. And now look at the calves. They don't receive any vaccinations unless they are a bull calf. I'll get back to that in a bit. But they don't receive any vaccinations until they are 60 to 90 days old, and they are just getting a 7-way clostridial disease vaccine at that point, and then prior to weaning they receive those respiratory disease vaccines, and up until that point they have been unprotected. So it is important that those cows and bulls and heifers are providing those vulnerable calves with herd immunity, and that herd immunity lowers the probability of a disease outbreak occurring within your herd, especially if you have a closed herd. Then that probability would be even smaller. If you quickly take notice of the brucellosis vaccine for replacement heifers, if you're deciding to keep any of those calves for breeding purposes, you need to work with a veterinarian to have them administer that brucellosis vaccine so that you are able to further prevent any infertility or abortions that may occur due to this disease. So up until this point, these unvaccinated calves are only able to fight off diseases with their physical defenses, such as mucosal membrane, stomach acid, natural microbiome, fighting off foreign invaders. They also have their innate immunity to call upon certain complements and have a broad, unspecific attack against any foreign invaders. They are able to develop a little bit of adaptive immunity at the time after birth, utilizing passive immunity. This can be natural or artificial, and it is seen when antibodies are given from the cow to the calf through the colostrum. And if there is not a way for this to be done in natural means, the calf can receive colostrum supplement, and there is no memory of these antibodies, and they are short term. So that is what the calf has to work with until they can develop some active immunity. And we have vaccination protocols, so that's why you normally don't see natural active immunity. Producers would rather not, because that would just mean you would have sick animals, and that means they're eating less, they're not putting on as much weight, they're not happy, they're not healthy. So that's why we have vaccination protocols and herd immunity, to keep our animals healthy. Active immunity, specific memory cells are developed, and it's long term. It is important to consider the biosecurity of your herd and to isolate and vaccinate incoming cattle prior to introducing them to the herd. Breeding soundness exams should be completed each year prior to the breeding season to ensure that those bulls do not have any venereal disease that could be passed to the cows, and the cows could continue to pass to the bulls, and so on and so forth. And you want to take good precautions of limiting outside exposure to other cattle, such as proper fencing, as proper fencing can keep cows from getting out and getting in with someone else's bulls, or someone else's bulls or cows getting in and mixing with your cows and mixing any diseases that may be present. In the La Pampa case study below, that was about bovine trichomoniasis and bovine genital campylobacteriosis, which both can cause infertility, abortions, and reproductive failures. Both of them are difficult to identify, and asymptomatic cases can occur, so it allows these diseases to spread undetected and can be difficult to maintain. Therefore, proper precautions such as vaccinations and limiting outside herd exposure are important in reducing those calf losses. Here are a few bulls prior to their breeding soundness exams, separated from the ladies.